Hi, my name is Nurse Alex. I'm going to be doing a comprehensive history today. And can I go ahead and confirm your name for me? If you can please spell that, your first and last name.
It's Jessica Williams.
Okay.
Jessica Williams, William. I don't know.
Okay. And can you go ahead and tell me what gender you identify with?
All of them.
Okay. And your age, Jessica?
Last time I checked, I think I was 24.
Okay. And what is your date of birth, Jessica?
It's that day where it's like Christmas, but it's like red, white, and blue. What is that?
I'm not sure. Would you say it's Christmas or would you say it's 4th of July? Okay, July 4th. And
July 4th, 1987.
Okay.
Because I read that in the Harry Potter book.
Okay. And can we go ahead and just check your armband really quick and confirm all that? All right, looks like that's in order. And let me just go ahead and ask, is there any history or condition of present illness or surgery?
No, I just get twitches here and there.
Just twitches? Okay, so you have, are they chronic twitches?
I don't know. They just randomly happen. I mean, I'll just be on the toilet and I'll twitch, or walking down the street and I'll twitch, or in my bed and I'll just start twitching.
Twitching, okay.
I twitched before I came into the office.
Okay.
Sounds pretty normal to me.
Okay. And any past health or medical conditions that we should be aware about?
Not that I know of.
Okay.
Try not to see the doctor too often.
Right. No news is always good news, I suppose. Any medications that you're currently prescribed?
Like.
Are you prescribed anything by any doctor?
Doctor?
Yes, doctors, like actual physicians.
I borrow some Percocets from Tracy sometimes, but besides that, no, I'm good.
So we'll say no on that. But you said you use Percocets
the good
occasionally.
Ones.
Okay.
Yeah.
So as far as health maintenance goes, do you exercise? What do you do to stay in shape or stay healthy?
Let's see. I fast a lot. I just try not to eat.
Okay, so
yeah, I find that not eating helps.
Fast frequently. Okay, well, fasting is a good way to, and if you're trying to cleanse, fasting is always good for that. But fasting for too long may not be good for you. So, history of family as far as illness goes: diabetes, cancer.
No.
Communicable diseases, mental illness, no illnesses at all that you're aware of?
I mean, I think I'm crazy. I mean, does that count?
No, that's going to be, we'll get to that later.
Oh, cool.
Yeah, so any allergies or reaction, including to foods, seasonal allergies, allergies to
I'm
pets?
allergic to carbs.
Allergic to carbs.
Mm-hmm.
Okay. And any particular carbs that you're...
Just carbs.
Okay. Substance abuse, are you concerned today about having any substance abuse issues?
No.
Okay.
Why would you think that?
I have just standard questions.
Okay.
Okay. Moving on. Do you use any tobacco products?
I try and smoke everything.
Try and smoke. So that's yes. How many tobacco products would you say, cigarettes, you use a day?
I don't know. I try to be creative sometimes. I don't really know. It's just whatever I can get my hands on.
So a particular number, 6 to 10?
About that. Yeah, 6 to 10 sounds good.
And you haven't quit that, right?
Quit what?
Smoking cigarettes, or you're not thinking
Why would I
about
do that?
quitting. Okay. How many years have you smoked?
I think I just came out of the womb smoking.
Okay, so it's been a really long time. Would you say it's been more than 10 years?
I would say so.
Okay.
Just about
more than 20 years?
I don't know.
Okay. Less than 20 years. Okay. And how many caffeinated beverages do you drink a day?
What's caffeinated?
They can include...
Does cough syrup count?
No. It would be things such as coffee, energy drinks, certain teas. Green teas, for example, will contain caffeine.
Long Island. iced teas count?
No, I don't believe that those.
Okay.
Okay, so no on that one. Okay.
Yeah.
And you said you drink long iced teas. How many of those do you drink a day or a week?
As much as I can.
Okay. So would you say 4 or 5 more a day?
Let's go with that.
Okay.
Let's go with that. This seems reasonable.
Would you say there's more? There's more on certain days than others?
Sometimes I switch it up, you know.
Okay.
Depending on the mood I'm feeling.
Okay. And aside from Percocet, do you use any sort of other drugs or medications?
Not that I know of. You know, sometimes I'll just get a surprise goodie bag. But besides that, no.
What do you think is normally in those surprise goodie bags?
I have no idea. That's what makes it even more fun.
Okay. And let's go ahead and move on to your oxygenation assessment.
Okay.
So, do you have any history of heart or lung disease?
No.
Okay, that's always a good sign. Any chest pain or palpitations?
When I wake up in the morning.
So in the morning? Okay.
Yeah, I take a downer sometimes just to stop it from, getting a little too much.
Okay. And do you have any sort of cough, like phlegm or anything like that?
Mm.
Okay. And can you go ahead and walk without resting, or are you feeling completely fatigued by just walking? None. Okay. And how many pillows do you use at night?
I don't use pillows.
No pillows.
Just wherever I can find a good, place to lay down.
Okay. And respirations, how do your respirations? Are they normally clear and with ease?
I think so.
Okay. So clear respirations, okay. And your skin, can I see your hands really quick? Okay. Your skin looks fine. It looks like
right?
You have enough sugar in it.
Mm-hmm.
Yeah.
I got these nails done, yesterday.
Good. Well, they look very nice on you. Oh, you didn't? Well, that's even better.
Uh-huh.
Okay, any sort of rashes or skin discoloration that you've noticed recently?
No.
No?
No. Actually, there was like an itch down there, and it was kind of red.
Okay.
But I sprayed some Windex, and it's okay now.
Okay, well, we'll get to that rash a little bit later, okay? Okay, let's go ahead and move on to sleeping.
Okay.
So, do you have any sort of history of sleeping problems, like insomnia, where you just can't fall asleep at night?
Oh, no, I never have that problem.
Okay. And how many hours a day would you say you work?
I'm always working.
Always working, okay. So would you say you work 12 hours a day, 16-hour
I would say
days?
12-hour days.
12-hour days. Okay, and do you sleep regularly? Do you sleep at a certain time and generally wake up at a certain time? Or is it kind of all over the place?
Kind of all over the place. Wherever I can grab a quick snooze.
Okay, so you do take rest periods and naps. Okay, that's good. So would you take 2 or 4 of those a day, or 1 or 2 long ones?
1 or 2.
Okay.
Good long ones.
Okay, so are those between an hour and 2 hours, or 30 minutes to an hour?
About an hour.
About an hour. Okay. And do you have any sort of sleep aid, like supplements that you take? Maybe you're taking any sort of like melatonin to kind of help you fall asleep, or
I take the Percocets.
Percocets. Okay.
I just when I feel numb, that's when I go to bed.
Helps numb to sleep. Okay. And are you in currently any sort of pain right now? Like high severity of pain, 1 to 10 right now?
I can't feel anything.
Okay, so no pain at all. That's good. At least that's good. Yeah. All right. And to your activity assessment, moving on to that, do you have any sort of history of joint or bone, muscle, or even nerve disease? You said you had some twitching.
Oh, I do have a little twitching. It stops after I take the Percocet.
Okay. And where do you normally experience this twitching? Is it in your arms?
Everywhere.
So is it, would you say, almost like a seizure?
I would say so.
Okay.
Yeah.
So a seizure, okay. And how often does this happen?
A couple times a week.
Couple times a week. So would you say 3 to 4, 5 to 6?
Say 4 times a week.
4 times, okay. And do you have any sort of history with falling when the seizure happens? incontinence or...
Yeah, after the episodes, I seem to have just pissed myself.
Okay. Okay, and any sort of like tightness or say really sore muscle feeling sensation afterwards?
Oh, a little bit. My chest seems to hurt a bit, and I get these achy pains here and there.
And where are those achy pains?
Like my joints, I think, my knees and stuff.
And your joints, and specifically in your knee joints, you said? Okay. And what kind of pain is that? Would you say it's throbbing? Would you say it's really sharp? Very dull?
It's kind of dull.
Dull, okay. And on a scale of 1 to 10, how bad would you say that is?
I think it's probably at a 6.
Okay. And have you used any sort of assistive devices with that, like maybe a knee brace to kind of help you with that?
No, just kind of walk it off.
Okay. And you are able to care for yourself?
Mm-hmm.
Okay. That's
independent.
Okay, good. And, okay, on to your nutritional assessment.
Uh-huh.
Do you have a history of any sort of GI infections or renal disease?
Not that I know of.
So no, okay. And in the last 24 hours, if you could please recall for me, what did you have for breakfast, lunch, and dinner, and if you had any snacks?
Okay. I don't eat. I'm trying this new thing where I just don't eat, but I smell my food and I get full off of that. I like to look at pictures too and get full. So the last thing I had today was I had a couple Percocets this morning, a couple around lunch, and then that was pretty much it.
Okay, so, but in a typical day, what would you say your breakfast is? Or is that what your typical day is?
That is my typical day.
All right. Any sort of dietary restrictions? I know you said you like to stop.
Allergic to carbs.
Allergic to carbs.
Yeah.
Okay.
Yeah. I will, however, take a random Slurpee here and there.
Okay.
Yeah.
Okay. And do you have a certain weight goal that you're trying to reach right now?
I like to stay a cool 70.
Okay. And you have obviously the ability to feed yourself.
Mm-hmm.
All right. And any sort of, when you do eat, do you have any sort of nausea or vomiting, any sort of pain or any of
when
that?
I eat?
Yeah. Any of those sensations? None of that. Okay. You don't bleed or anything like that, right?
No, I just get the occasional stomach ache.
Okay.
After I eat.
Okay. Stomach ache, right. And that's typical, if you oftentimes eat very little amounts of food or you eat in between very long periods of time. Sometimes that can be very usual.
Uh-huh.
All right, so a little bit to the more personal questions. I need to go ahead and ask you about your bowel movements. So
Okay.
I would like to know, do you normally have a bowel movement every day?
Yeah.
So every day, okay.
Once a day.
So when's the last one that you had?
Was this morning.
This morning?
That's
Okay.
clean myself up.
Okay. And do you normally have them in the morning?
Uh-huh.
Okay. And how would you say your stool appeared? Was it dark? Did it float?
It's really dark.
Okay, really dark. Okay.
Really hard.
Okay. And are you continent?
I would say so.
Aside from, when you have your seizures?
Yeah.
Okay. And have you had any sort of symptoms of diarrhea, or have you seen any blood in your stool? Have you seen
a little bit of blood?
A little blood, okay. Now, do you think that could possibly be from any hemorrhoids? Do you have any pain when you have a bowel movement?
Sometimes.
Yeah. Okay. And do you have any concerns about hemorrhoids?
No.
Okay. All right. So on to more elimination.
Okay.
How many times a day would you say you void?
What does void mean?
When you urinate.
I don't really know. when I get thirsty, I like to drink some water.
Mm-hmm.
And, I don't really pee that often.
Okay.
I try to hold it in sometimes.
Okay. Would you say that you normally void maybe just once or twice a day?
I would say so.
Okay. And when's the last time that you voided? This morning, okay. And would you say that you voided about a cup, maybe two cups?
Maybe a cup.
A cup, okay. And how would you say your pee appeared? Was it a very dark color?
It was very
brown?
dark, yeah.
Was it a brown color?
I don't know. It could be brown. It was really dark yellow.
Dark yellow, okay. Was it cloudy?
I don't know. I don't want to look at it.
Okay. Did it have kind of a funny smell?
It was really funky.
Okay. Yeah. Okay. Then you do have continence on that. Okay. And do you have any sort of symptoms of, like I said, odor, or do you have any pain when you void? Any sort of
void.
Okay.
It's just really itchy.
Okay. So it itches when you void. Okay. Okay. So away from that now, we're going to go ahead and just do a quick safety and security assessment.
Okay.
How would you say your hearing is?
Pretty good.
Pretty good. On a scale of 1 to 10?
A 10.
10. Okay, perfect. And your vision?
It's good. I can see you.
Okay. On a scale of 1 to 10?
10.
Okay. And do you use any sort of hearing or visual aids classes or anything like that? No. And you seem like you have fairly good orientation because you can see right me. And any sort of exposure to, say, occupational or recreational substances like noise or chemical agents, anything like that?
What?
Like, say, have you had any sort of exposure to toxic chemicals like cleaning supplies or asbestos?
Not that I know of.
So none. Okay. And do you have any sort of financial concerns right now? No? Okay.
I'm just kind of living on whatever the streets give me.
I see. Okay. So psychosocial assessment. Any history of mental illness or depression?
No.
No. Okay. And what would you describe your present emotional state as?
Pretty stable.
Stable, okay. Would you say you're happy?
I'm happy. Yeah.
Okay. That's always good. It's always good to keep a positive attitude.
Gypsies are always happy.
That's great. And do you have any symptoms of anxiety, stress, or depression, grief?
When, like, Tracy gets really stingy and doesn't share with me, I get really anxious about that.
Oh, I see.
Besides that, no.
Okay. And about your support system. Do you have a primary social support group? Do you have somebody where you feel like if you needed to feel secure or who could take care of you if something happened? Do you have a support group? Like a church group or maybe just a really close circle of friends?
Just Tracy.
Just Tracy, okay. And as far as family goes, any relatives like mom or dad or sister, any siblings?
I have, like, a sister and, like, an older brother, but, like, I don't know. I don't talk to them that often. I haven't seen mom and dad in a bit.
Okay.
Yeah, I've just been kind of living on my own, Just me and Tracy, just gypsies.
Mm-hmm.
You know what I mean?
And do you feel like you have an adequate amount of social support?
Yeah.
Okay. And as far as sexuality goes, do you have a sexual partner that you are with right now?
Tracy.
Okay. And as far as your partner is, do you have any sort of exposure to an STD? Are you using any sort of protection or contraception right now?
No.
So no contraception?
Mm-mm.
Have you ever been on contraception?
What is that?
Contraception can be anything as far as birth control. It can range from condoms to oral contraception to IUDs, which is an implant that prevents you from getting pregnant. So any history of using any of those?
Mm-mm.
No? Okay. And what are you doing as far as STD exposure and protecting yourself from that? Not really doing that. Okay. And as far as your self-esteem and the relationship, do you feel like you are fulfilled and happy with this person?
I'm very happy.
Okay, good. All right. And onto your education. What is your education level?
Yeah, I have a master's in philosophy and a minor in culinary arts.
So you like to cook?
Yeah.
What is your favorite thing to cook? Anything? Seafood?
Everything.
Okay. What do you cook for a living now?
No.
No? Okay. What is your current occupation?
I don't know.
Would you say you're just currently taking some time off work?
I would say that I'm an adventurer.
Okay. And you clearly have the ability to effectively communicate, so we'll just go ahead and check that off. Can you describe to me your type of residence? Do you live in a home or
just out of our van.
okay? So still a stable place to stay. Okay. All right. And any sort of religious or spiritual needs that you practice? Do you belong to any particular religious group? Okay. And what are your hobbies?
I don't know. No real hobbies.
No, well, everybody has to have some hobbies. I mean, you said you went to school for cooking, so you must love to cook.
I guess,
So cooking.
It was alright.
And do you do any sort of volunteer work?
No.
All right. And do you have any other information that you would like to release for me today?
Not that I know of.
Okay. No other information. And do you want me to look up any resources on something you may be interested in?
That'd be great. Thank you. You're so nice. I feel so loved here.
All right, Jessica. Well, this concludes our comprehension history. Thank you so much. And I will go ahead and enter these into the computer, and your physician will be in right away.
Cool.
Okay.